Hi, this is Chris Smith with Local Joe's. At Local Joe's, we help local business. Hi, this is Chris Smith with Local Joe's.
This is City Pulse Newsmakers, a weekly look at the issues and the people behind them in Greater Lansing. Brought to you by City Pulse, Lansing's weekly alternative newspaper. And now, here's your host, City Pulse publisher, Burl Schwartz.
Good morning. Lansing has received a grant to help it address the health of lower income individuals. So what are the discrepancies faced in our community over health, and what can be done about it? We've assembled a panel today to talk about that. With us are Ingham County Health Officer Linda Vail. Welcome back, Linda.
Thanks, Burl.
And Stella Cash, who's the Vice President of Sparrow Health System. Welcome.
Thank you so much.
Dr. Ed Rosick, who is the author of a brand new book called Optimal Prevention and directs the Healthy Care Initiative at Michigan State University, Healthy Campus Initiative. And Carl Dorshemer, who's the Development Director of LEAP, that's the Lansing Economic Area Partnership. Carl?
That's correct.
Good to see you.
Nice to see you too.
All right, so Linda, let's start with you. Tell me about this grant. Where did it come from, and what's it meant to do?
The grant comes from a collaboration between the Robert Wood Johnson Foundation and the Reinvestment Fund. And what it is a very targeted effort at bringing community investment, community development, and health together. Not a common always partnership to look at how it is that we develop our communities, invest in our communities, and at the same time, by doing those things, improve health in our communities. So the grant will have us targeting specific neighborhoods where we have our largest challenges around health disparities, where basically low-income folks, people of color, have particularly poor health outcomes relative to richer and whiter folks.
And what are those neighborhoods?
Well, they're largely the city of Lansing. There's a neighborhood in the southeast, southwest, northeast, northwest, and central. So we actually targeted we have 5 different areas, which really encompass a large part of the city. The city is challenged in that way. In most areas, if you look at some of our mapping. So there are pockets that are not that way, but generally we see that in the city.
Carl, why is this important to what's basically an organization to drive our economic engine?
Well, at LEAP and also the LEDC, Lansing Economic Development Corporation, we're concerned with the health of the business community, but along with that comes the creation of jobs, quality jobs, and also workforce issues. And then we also know that businesses typically, when they want to locate or expand, they want to be in a healthy community, they want to be in an area with strong neighborhoods. And there's a definite link between income levels, quality jobs, jobs that have health benefits, and the condition of the neighborhood, the health of the workforce. So we do a lot of things. It's a very intertwined type situation. So we're concerned all the time with the whole of the community.
And Stella, how do these kinds of health issues among lower income individuals, racial minorities, how does that affect running a hospital?
Well, one of the things that the big change that has occurred in health systems across the country is now the emphasis on prevention. Prevention of health conditions that we have some control over. But if you look at our neighborhoods, just something as simple as children going outside to play. I mean, when my kids were little, they could take off on a bike and come back at dinner time. And that's not the case anymore. And so then you begin to get into the situation of our children being obese, and part of it has to do with the safety of the environment in which people live, because then they don't feel free to go outside to play. So, if you look at the new direction for health care, it really is focusing on prevention.
Well, this is a perfect time to talk to you because your book is called Optimal Prevention. What are your thoughts on prevention and economic disparity?
You're absolutely right. As Stella was just saying, really preventive measures are really the way to look at some of the chronic disease issues that are affecting all of us, not just poor neighborhoods, but everybody, but especially in the poor neighborhoods because they don't have access to health care. They don't have access to education, what they need to do. So without primary preventive models being models that target people, target communities, target populations so that they don't develop the disease state, be it heart disease, diabetes, cancer, whatever in the first place, we're going to keep continue to see rises in these chronic diseases, which we're seeing all over, especially in lower income neighborhoods.
Linda, how much of the problem in Lansing is addressable by government, for example? You run pretty big government operation.
Yeah. You know, part of it's addressable by government, but it really is a partnership, which is, I think, why that the Robert Wood Johnson Foundation and the Reinvestment Fund specifically wanted teams put together the way that ours are put together, a community development partner, a large anchor partner like a health system institution and a government sector and also the city. So, you know, we really can't affect large-scale systemic and policy change without engaging people across all of these different sectors. So when you talk about prevention, you know, we can work with individuals on prevention and say, you know, activity, diet, those sorts of things that's going to prevent you from getting sick. This is really more about social structure and systems and policy and how we address those issues than to address population health at large. So, for example, lead-burdened homes in the city. If you look, lead-burdened homes. So if you look at lead-poisoned children in Ingham County, about 90% of them are in the city, and about 70% of those are in rental housing in the city. That tells us something about where that's coming from and why, and what kind of policy changes we might make around addressing those issues so that we don't have children with elevated blood levels, as opposed to just, you know, case management programs around monitoring their blood levels and then addressing it once it's happened. Payday lenders is another issue.
Why do we see so much in rental housing?
It's an older housing stock in general, and also it is, you know, when you're in a rental house, sometimes you know more about your house when you own it rather than when you're in a rental. And also, you know, it's various degrees of enforcement of codes or incorporating things into codes and code compliance around lead hazard mitigation, and whether a community has, you know, the wherewithal and the motivation to do something like that, and that can make significant change.
Carl, we saw, as a result of the 2008 recession, we saw quite a reduction in city services. And one area that particularly hard hit was housing inspection. How does that play out as far as a community attracting business?
Well, there's two sides to that. A healthy community, a healthy economy with strong businesses generates a lot of tax money. And tax money is what essentially pays for those services. Mm-hmm. So when you have an unhealthy economy where the tax revenues are fallen, then there's cuts that have to be made in the public sector. You can't do everything that you want to do. So there's a relationship there. So in terms
but it's kind of a catch-22 thing. Mm-hmm. Right. The less healthy the community, the less business you're going to attract.
Right. It's chicken and egg. Right. So we work on both sides. But definitely you rarely find a healthy community that doesn't have good quality jobs. A certain percentage of that population making good money. They can take care of their houses. They can take care of their needs, and they also typically have pretty good health care too that comes along with that job. So there's definitely, on the other hand, a business looking at a community, if they see a community that's unhealthy that needs work, then they might hesitate. So, but on the other hand, the costs, typically the cost of operations would be less too. So it's a balancing act.
Yeah. Ed, you work in East Lansing. You're at Michigan State University. Do you see a healthier clientele by and large?
I see everybody. I see people that have top of the line Blue Cross insurance. I see people that have bare bones Medicaid insurance. And certainly there's a difference in care, not in the care that we deliver as physicians or as caregivers, but the care that we can deliver in terms of what tests can I do, what services can I refer people to, what medications will be paid for.
Mm-hmm.
So there's a huge difference. Again, certainly the Affordable Care Act did broaden the scope of people with insurance to some degree, but it certainly is not a cure-all for everything.
Yeah,
So,
and Stella, I recently had to go to the emergency room at Sparrow, and it was packed. And does that remain despite the Affordable Care Act?
It does. It does remain. Some people, they don't have money for the deductibles. They know they can go to our emergency department, and we see everyone. We are a Trauma One hospital. We see and we treat everyone. Now, one of the things that we are doing and we have done that we hope is going to help is our new fast cares. We have opened 3 within the last year, and we will be opening another one in August. We have one in downtown Lansing that would service that population. We have one in Frandor. Last week we opened one in the Okemos Meyer, and then we will be opening one in August in the DeWitt Meyer. And so we hope that this is the low cost center. If you look at an emergency department anywhere in the United States, that's your highest cost center. And so there's just no comparison in the cost. So if you go to a fast care, there's limited types of care that you get. For example, if you wake up and you have a sore throat, you feel terrible, but you don't need to go to an emergency department. You can go to a fast care. So it differs then from the emergency department, and we hope that'll
If you don't have
relieve it.
insurance, will you still be seen at a fast care?
Yes.
Just like if you go to the emergency
Yes,
room. They have to
and
see
and
you.
you're looking at $69 for our fast care.
And so what's the outside? What do you need to take to an emergency room that fast care can't deal with?
Well, fast care really is simply we don't do sutures. There are no X-ray, but it's the minor things, the minor scrapes and bruises and sore throat, ear infection, those kinds of things. I've got a splinter in my finger. You need to take care of it. But you don't. We're also going to be doing physicals for high school athletes. So, but you don't need to go to an emergency.
Yeah, but Linda, how big of a barrier, though, is $69 to some people in our community?
Oh, $69 is a complete barrier to some
Absolutely.
folks.
It's
It's, I mean, that's it.
So what do they do? What should they do?
What should they
in our
do?
community? What can they do?
Well, we run a network of primary care clinics, our federally qualified health centers, or clinics with federally qualified health center status. So we provide primary care to the population at large. In terms of urgent issues, there's still. I mean, we're not an urgent care. We're not an emergency room. We so if it's an urgent care or an emergency room kind of event, then you need to go there. Urgent care and fast care, while they both serve their role, and a very valuable one, are not to really keep you from getting into that patient-centered medical home or primary care home. What we really want is for people to be in a primary care home where you have a relationship with your provider, where they kind of know you and about you and can connect with the other providers that you might be interacting with to make sure that your care is coordinated and all of that. So
And that's a major
what
issue.
we really want is for people to have primary care homes throughout the community.
Ed, what are some things that, if you were educating a lower income household, what are some things you would say, okay, here's what you really need to learn?
It's a great question. Basic things. Number one, quit smoking. The vast majority of people that I see in my clinic who smoke are in the lower socioeconomic classes. The people that can least afford paying $7 a pack for smokes, and the people that can least afford the secondary health dangers from smoking. So quit smoking. Try to eat a balanced diet. Again, the way the entire food industry is set up in this country, what's the cheapest food? Our fast food, the dollar menu. That's the worst food in the world. So avail yourself to the farmers markets that we have now. Get some fresh food. And as you were talking before, get exercise, get out and move. We as human beings are meant to move. We're not meant to sit on our butts all day like I do and most of us do in our job. So those three things can make a huge difference.
But back to the reason that these grants in these cities were identified, you know, that's all great stuff. But when your neighborhood's not safe,
Oh, absolutely.
you can't follow that advice.
Absolutely.
When you are limited in terms of your ability to have transportation, because that's another one of your worries, and the nearest grocery store or farmer's market is
Absolutely.
too far away from you, then you almost are forced to shop at places where you're going to be buying lower quality food. So in some cases, like, yeah, teach people that, but on the other hand, we have to set up our communities in ways that allow people to make those choices, despite some of the other challenges that they have. So safety, access to fresh foods at markets, grocery stores, as opposed to convenience stores and liquor stores, and all of that sort of stuff is really important to make sure that we build into not just the wealthier of our communities, but into all of our neighborhoods and communities.
How unsafe, though, are our communities? Now, I'm still prejudiced by having a kind of a big city background, and it's hard for me to take seriously people's fear of going into certain neighborhoods. I mean, do we really have unsafe neighborhoods in the city of Lansing?
We do.
Absolutely, we do. I mean, you know, you and I have talked before. We have a heroin and opioid epidemic going on. When you've got that kind of trade going on in the community and people using those kinds of drugs in the community, then you have a lot of other kinds of crime that go along with that, theft and those sorts of things. That is going on in this community. It absolutely is. There's a lot of great things going on in this community too. So, you know, let me make sure that we balance that out. But
I think you can always find communities that have worse places and communities that have better, and throughout the city, there's a wide spectrum.
Right, and I think we want to be better. I think we want to do better, and I think we want to be better for everybody that lives in Lansing.
Carl, what do you see the role of LEAP in this project?
Well, we represent economic development, represent the businesses, represent jobs. You know, we realize that a lot of these issues, you know, there has to be income sources to the public sector to help with this. We also have a brownfield program. You go in these neighborhoods, you find old retail, old gas stations, old factories, and they don't contribute anything positive to that neighborhood. It's negative in almost every way. But we have programs where we can find an investor, find somebody who's willing to take a chance on that property. We have incentives that have the ability to essentially level the playing field so that that site is attractive, because it comes with additional costs associated with being a brownfield, and make it productive, bring it back to life, get it on the tax rolls, generate jobs, do a lot of things that ultimately translate into a healthier community.
This is a huge problem. This is a small grant, really, in the scheme of things, right? $60,000. Linda, what can be done to make a dent in this problem with $60,000?
Well, you know, I had that same question when my staff came to me about this grant and applying for it. I'm like, well, wait a minute, $60,000. Like, okay, that's the planning stage. Then after we get through the planning stages, there's another grant, right? The big one comes after that. No. I'm like, well, wait a minute. So a big part of this also is, you know, it's an opportunity, it's a networking and a connection opportunity for the team that we've put together. The plan that the Robert Wood Johnson Foundation and the Reinvestment Fund has for us, a lot of it is connecting to investors. So once teams in these communities that have been identified come up with actionable, sustainable plans. They are networking you with investment opportunities across the country in order to realize those plans in your community. So while it's not, let's give you a grant and go ahead and do that, it's like, let's get you going, let's get you into some learning labs and teaching labs, let's, get a team together and get you working across these different sectors, let's help you flesh out some ideas. Then once those ideas are good and fleshed out, let's connect you with investors that can help you make that happen in your community.
Stella, what do you think Sparrow can do? Any specific ideas yet?
Well, I wouldn't say, I wouldn't even address that at this point, because what I hope will happen through this initial grant is, you've already got people at the table that probably their paths don't typically cross. People that are influential and organizations that are influential. And once we have an opportunity to learn, then we will probably come back and we'll make some decisions about what do we want to address. We can't go into a neighborhood and cure everything. We can't go into the city of Lansing. So if we think big, we want to change these neighborhoods, but we start small. We were talking earlier, one city just did, they focused on the street lights. That's all they focused on. Street lights for the entire, and they went neighborhood by neighborhood. Well, if you do something like that, then you begin to address safety. Then if you address safety, then you begin to impact health. Something that we think simple, but it could be huge. Is it transportation into the neighborhoods? Linda's right on target. I'm a dietitian by profession, so I certainly, know the necessity for good food. But if I have to walk a mile and carry a child with me to get food, I'm going to go to the closest place that I can get. So we've got to be realistic about that.
Carl, a few years ago, Quality Dairy tried to put fresh fruits and vegetables in some of its locations.
Sure
and I'm not sure that it's even doing that anymore.
I think they still have bananas.
Is there a way to sort of network this? You've got businesses in every community. Is there some way to get what people need into businesses that aren't necessarily purveyors of food?
You're talking about in terms of changing the choices that are available?
Yeah.
It's
Where you are,
difficult
when
because
you're
it
in a
typically
food
is
desert.
demand. Yeah, it's demand driven. I think they're selling what people are buying,
Right.
and it's hard to change people's tastes. On the other hand, you could say that, well, how are people ever going to try something new if when they go in the store, it's the same old thing? So in our role, really, it's difficult for us to dictate what a business carries in their
Right.
store.
But is there a way to
But
create an incentive for it?
I don't know. I think it's the bigger picture is the education, and I see a larger effort that's going on in the community, and I see the billboards and others where are trying to teach people to make healthy choices, and a healthy
Eat more
choice
fruits and
essentially
vegetables.
creates demand, the demand for those particular items like fresh fruit. Therefore, a store responds typically to the demand, and rarely does supply create demand.
I'm kind of flashing back to my childhood when once or twice a week someone came around with fresh fruits and vegetables, honest to God, drawn by a horse. That's how old I am. But it does make me wonder if there is an entrepreneurial way of doing
Well,
that.
one thing I see going on a lot is that people want to eat and drink local now. They really, it's become, it's kind of come full cycle because that's the way it used to be.
Right.
If you go to Europe or go to other places, that's the way it is. It's always been. And so that is a demand that people want things that are locally produced, and they're willing to pay for those. And so, and I think the infrastructure out there, the small-scale farmers, the craft brewers, all these others, and even the inputs that go into those things are starting to spring up here locally. And we can help with that because that's business. And then that translates, I think, into a healthier lifestyle because people are starting to be choosy about what they eat, what they buy, and also it helps the environment because there's less energy being used, and you eat seasonal, and there's a lot of benefits that come with that type of a lifestyle. So that's one area I think that we can help.
Ed, you work for the biggest educational institution in our part of the state. Education is obviously a role because you can put fresh fruits and vegetables on every corner, but if people don't realize they should be eating them, could MSU play a role in Lansing to improve this?
I would think so. Again, I'm a small fish in a huge
Right.
ocean, so I certainly don't dictate. But I think MSU is trying. We're certainly trying in our own community. The Healthy Campus Initiative that looks at Michigan State as a 50,000 plus town or community, and we are. So I think that's a great step forward, and perhaps that will then further encompass the greater Lansing area.
Okay. I want to turn to another health topic, if I may, Linda, since you're here. The Forest Community Center opened
Yes.
recently.
Yes.
How's that going?
It's going fabulous, and if you haven't had a chance to go out there and see it, it's a beautiful facility.
I have seen it. It's great.
So,
And what does it provide the community that it was missing?
well, actually, we just moved one of our clinics, so
Okay.
it's not something that was missing. We do have more space there. We have a better layout there. So our clinic flow and patient population, we can do a better job of serving folks. We've put our dental operations together, so we don't have children's dental and adult dental in separate locations anymore. We do all our dental in one location. So the clinic is the former clinic that was in our building right there on Cedar and Jolly, that we moved all out of there and into the Forest building.
Okay.
So,
What's on the horizon for you?
what is on the horizon for us? Well, this project is on the horizon for us. As you know, we're still working on this heroin and opioid issue in the community. We are, looking at where else we can be or might be able to be with our health centers, our primary care centers, and whether or not we need to be yet at other locations in the community. We are taking a look at our school-based health centers and making sure that we serve a broader population and increase ways that we can see children in their school settings and kind of streamline our processes around that. And as always, we are looking at issues around these health differences or disparities, as you call them, and really trying to make a difference when we talk about things like health equity and how it is that we look at our communities and policies and systems and try to create equity so that people have a chance at optimum health.
All right, very good. Well, I want to thank all our guests. Linda Vail, the Ingham County Health Officer, Stella Cash, Vice President at Sparrow Health System. Ed Rozek, again, author of the new book, Optimal Prevention. Ed will be writing a column once a month in City Pulse on health issues. We're looking forward to that, I think, starting next week. And Carl Dorshemer from LEAP, Lansing Economic Area Partnership, and I always struggle over that one, tongue twister.
Me too.
But appreciate your being here. If you haven't noticed, the Summer of Art has started in City Pulse. We ran our first piece of original art by a local artist on our cover this week. We'll be doing that now through the end of August, and we're going to go out showing you that piece of art. Thanks for watching. Have a great Memorial Day weekend. See you soon.